As a psychiatrist, I'm not only trained in helping people start SSRIs to help manage various mental health symptoms, but also to help people get off when it's appropriate. But as I'm sure many can attest to, stopping an SSRI is not always easy and can be very uncomfortable. So in today's video, I'll be discussing what an SSRI withdrawal syndrome is, what factors into whether you experience it or not, and of course I'll discuss some methods that us psychiatrists use to help people taper off these medications fairly seamlessly. At the end of the video, I'll also touch on some of those online companies I've been reading about that claim that they can get you off SSRIs in some unique way. And for those of you new to the channel, I'm Dr. Robert, a board-certified psychiatrist. I enjoy making these educational videos on mental health topics, and if you enjoy this video, my other videos, please like and subscribe. It goes a long way. I appreciate it, and let's go ahead and get started. Okay, so let's start off with what is SSRI withdrawal syndrome, and then also discuss what will influence whether you experience this or not. So SSRI withdrawal syndrome, or discontinuation syndrome as it's also known, is basically a cluster of symptoms that people can experience when they're coming off of an SSRI, or selective serotonin reuptake inhibitor. So some common SSRIs I'm sure you've probably heard about are things like Lexapro, Zoloft, Prozac, Paxil, or other ones as well, but those are most commonly prescribed ones. Many millions of Americans take them, whether it be for OCD, anxiety, depression, PTSD, or a host of other mental health conditions. They can be very, very, very effective in treating people with mental health symptoms, along with, of course, therapy, lifestyle changes, and all the other good things I talk about. But they are very useful, but can be difficult to come off of in some situations. The withdrawal symptoms can include many various things. For some people, it almost feels like a flu, kind of these body aches, hot sweats, not sleeping well, kind of just feeling very ill and off. Other people describe these sort of brain zap sensations, almost like this kind of zapping feeling in their brain, in the back of their spine, in their hands, and these kind of just odd nerve-like sensations. Of course, they can also include worsening mood, anxiety, trouble sleeping, and other sort of experiences that are very wide-ranging. And none of these withdrawal symptoms are dangerous or life-threatening, but they can be very, very uncomfortable. So what influences whether you'll experience this or not when coming off of an SSRI? For the most part, I would narrow it down to 4 factors influencing whether you'll experience this or not. The first one is going to be how long have you been on an SSRI? That's going to be a big factor because if you've been on it for many years, decades even, much higher likelihood that your brain's going to notice this medication all of a sudden being gone than, for example, if you're on it just for a few weeks and maybe we're even still adjusting to it. So the longer you've been on an SSRI, the higher the likelihood is that you'll experience some sort of discomfort when reducing the dose drastically or stopping it altogether. And then the second factor would be the dose, which makes sense, right? The higher the dose of the SSRI, the medication, again, the more your body is going to notice a drastic reduction or that medication fully being out of your system suddenly. The third factor will be the half-life of the SSRI you're currently taking. So if you're taking a medication like Prozac or fluoxetine being the generic name, that's a medication with a very long half-life, about 72 hours for most people. So that's medication is going to kind of gradually taper itself over the course of days. So even if you're on a moderate, low dose of that, most people can stop that medication and not experience much, if any, discomfort at all because it self-tapers itself due to the long half-life. Then on the opposite side of that scale is medication like Paxil or paroxetine, the generic name. That medication has a very short half-life, and so people are going to experience the withdrawal from that much more readily than they would with a long half-life medication like fluoxetine. Basically, the medication is leaving your system much faster, so your body is going to notice its absence much faster. It's not as a gradual of a decline, but more of a sharp sort of abrupt stop when it wears off. And then the fourth factor that determines the severity and likelihood of that withdrawal syndrome is just unique individual metabolism. I've certainly had people who've been on Lexapro 10 milligrams for many, many years. It's been very helpful. Then they decided to come off of it just because they feel like, things are going well. They don't need the medication anymore. And they can just stop it cold turkey. And it's like nothing ever stopped. And they go on continuing their lives without any issue. Other people experience very severe withdrawal syndromes. Same exact duration of use, same benefit, same medication, same dose, hugely different experience. And that greatly speaks to that everybody is a unique individual. There's no one single route or method for a certain situation. Everybody is different, even if a lot of the factors seem similar. So then, what are some of the methods that I use, that psychiatrists in general use, to get people off of SSRIs or reduce their dose for whatever reason? So let me walk you through my approach. The tried and tested Dr. Robert method. First thing I ask my patient is, why are you looking to come off this medication? What's the story behind your current desire to come off of it? And this can include a whole variety of reasons, right? As I'm sure you can imagine. Sometimes it can be that someone's just recovered from their mental health symptoms, everything is going well, so they want to come off the medication, just continue the therapy and lifestyle changes that they've implemented. Other times it's that they're experiencing some major side effects from their SSRI and they want to reduce the dose or come off of it completely because of that. Of course, I always get a sense of what was their prior experience with this like? Did they try coming off the medication in the past and went fairly smoothly, or did it cause a lot of distress, a lot of issues? And so we'll have to go with a more conservative approach. So then I get into the tapering plan. Once we've established what they've been on, their history around it, their expectations, beliefs around it, we get into the nitty-gritty of what do we do next. Typically, the most easy thing to do is create a gradual taper plan. And depending on how long they've been on it, the dose of it, the type of medication will determine how aggressive it is, whether we can do it in 2 weeks or 2 months. It's also useful to know, I think, for you out there that you shouldn't feel alone in this process. You should feel like you're collaborating with a doctor who respects your experience of this and being able to communicate readily, or fairly readily at least, as to how to go about it, making the adjustments if they do need to be made. And you shouldn't feel too thrown off if the doctor even proposes throwing on another medication to help cover up the withdrawal syndrome. So like I mentioned before, that medication fluoxetine, the SSRI with a very long half-life, tends to self-taper itself quite well from people's system. But it can also be used to help people taper off of other SSRIs or SNRIs, or using other medications like gabapentin just temporarily to help with that withdrawal syndrome. And then I mentioned I'd talk about these online companies that have popped up to meet the demand of people's desire to get off of SSRIs. My main concern with these online platforms is that perhaps they'll, one, create an expectation of them being able to do something a regular psychiatrist can, and two is that if you do seek out their services, get plugged in, get off an SSRI, you might not have someone readily available if anxiety, depression, other symptoms start to pop up weeks or months after coming off of this medication. Perhaps the one thing that they do offer that's unique is their ability to prescribe or send medications in doses that are perhaps smaller and more individualized than you would be able to get at a typical pharmacy. But even in my 5 years of tapering people off these medications, I've never run into the type of issue that required me having any sort of weird dosage. Anything that the pharmacy will typically do. But if anything, these companies do bring attention. They sort of highlight the issue of SSRI withdrawal syndromes, get people talking about it, and get providers considering how can we make this smooth for our patients. And of course, if you're an underserved area, an area where perhaps you don't have access to a psychiatrist, can't get in with one, then this might be a useful resource for you. Major concern that I forgot to bring up is whether or not they do a full assessment of whether it's appropriate or not to take someone off of a medication and not instead replace it with a different medication, or perhaps just reduce a dose or make other medication adjustments outside of taking someone off of a medication. Because of course, right, their entire business model is taking people off meds. So I do worry that they may also overlook whether or not it's appropriate to do that or not. I'm sure they have some protocols for that. And again, I don't have personal experience working with these companies or have had any patients that have worked with them, so I can't speak off firsthand account. But that is a concern because many times when patients come to me wanting to come off a medication, when we dig deeper, I notice that it's oftentimes a side effect, a misconception about a medication or something else going on, whereby perhaps just reducing the dose or switching medication type may better address their concerns and symptoms. So what are my final takeaways? One, of course, anybody on an SSRI, SNRI should be able to taper off, reduce their dose fairly smoothly with the right guidance from their prescriber. There are many factors that will influence whether you experience SSRI withdrawal or how severely you'll experience it. But end of the day, everybody's a unique individual and there's no way of fully telling until you try. And finally, there are these online companies offering to do this in some unique way. But in reality, they're just following the same strategies that most psychiatrists use. And I think it's always going to be best to have your own psychiatrist help you with this, because then they can also, one, they already know who you are, have a sense of what your experiences have been, and if any issues arise after you've tapered off, you can always go back and see them. All right, my friends, thanks so much for watching today's video. I really appreciate it. I hope this was informative, useful to you. And if you like this content, please like it and subscribe. It helps the algorithm pick up this new YouTube channel. I'm definitely eager to make more mental health videos, and thanks again so much for watching, and I'll see you next week.